Hi, this is Brian Kim. I'm going to share with you how I'm going to extend the Phaco sleeve in order to do double chop, cross chop, and mechanical fracturing of the Catarock. So you can imagine the cataract is so dense and I'm doing the chop maneuver, the sleeve may interfere with how deep I can penetrate with the phaco tip. And so I like to extend the phaco tip by pulling the sleeve back. It extends the metal component of the phaco. And recall the phaco is not going to be used for phaco energy or vacuum at all. I'm going to use it purely for a mechanical fulcrum. And I'm using the phaco tip like a chopper. And that's why the technique is called double chop, because I'm using the phaco tip as a chopper, and I'm using the chopper and the phaco tip to both crush the lens so that I can bisect the lens completely. In a case like this, when the lens is so dense, the anterior posterior diameter is so thick, you want to extend the phaco tip to get around the girth of the lens. And by doing this, I'm able to minimize and reduce the risk that I'm going to get a posterior plate, and I'm able to fracture the entire thickness of the lens by doing this maneuver without having to sculpt, without having to do any additional maneuvers or trying to sculpt a posterior plate or chop a posterior plate. Now, I know what you're thinking. Conventional wisdom says not to pull the sleeve so far back from the tip, because if you do that, the irrigation fluid is going to be away from the tip. And so as you're doing the case, the irrigation fluid can come out of the eye, the chamber will collapse, and it can cause a complication. And so I do want you to know this is only for that initial chop when we're trying to chop through the girth of the lens. And once I'm able to do this, I'm going to reduce the sleeve back to the normal configuration. So as you can see here, I'm extending the sleeve quite a bit far back from the tip, and it's actually towards the angle of the phaco tip. I'm going to lift my incision with my chopper. I'm going in with the phaco with irrigation off to minimize Descemet's trauma. And then I'm going to go ahead and begin the phaco. I'm going to try to remove the surface epinuclear material, but this is such a dense lens, there is no epinuclear material. I'm placing chopper out to the equator into the capsular fornix. I'm turning the phaco tip deep in the subincisional space vertically, and I'm bringing both instruments together. And as I do this, you can see the lens will fracture completely. You can see as I pull with the chopper, I'm keeping the phaco tip in place. I'm using the chopper to kind of tease along the fracture point. And as you see, as I do this, the entire lens is bisected. There is no posterior plate. In doing this maneuver, I place the chopper out to the contralateral equator. I pull the chopper towards the phaco tip, and this fractures the right heminucleus, and this is the cross chop maneuver, bisecting the right heminucleus. By using mechanical fracturing, I was able to break this cataract into 3 pieces without ultrasonic energy or vacuum. Now I'm going to take the chopper out, and you can see I'm going to turn the sleeve so that the sleeve is going to go back into a more normal configuration. The sleeve is closer to the phaco tip, and now I can resume the mechanical fracturing and begin to start to emulsify and remove the lens. Since there's not much epinucleus here, I'm being very careful when I'm trying to slide that chopper out to the equator. I want to make sure I'm underneath the anterior capsular rhexis edge. So I actually grab the lens with a little bit of vacuum, pull it centrally, and then I was able to get under the edge, and then I fractured and bisected that first quadrant. You can see this is a very dense lens. I'm crushing the lens successively. I made sure that the lens was out of the bag when I do these crushing force maneuvers. As I crush the lens pieces into smaller pieces, I then pulse it with some vacuum and ultrasonic energy. You can see I'm using quite a bit of high vacuum and then intermittently pulsing with the ultrasonic energy to minimize the energy. I'm again using mechanical fracturing forces to crush the lens pieces into smaller bite-sized pieces. You can see the brunescence of this lens. And again, I'm just taking my time, crushing the lens pieces, and then emulsifying the lens pieces. So that first quadrant is gone. I'm going to place the chopper underneath the anterior capsule edge. You can see this is such a dense lens. There is no epinuclear material, so I don't have that as a frame of reference. So I'm trying to be very careful, making sure I'm under the anterior capsular rhexis edge. I turned the chopper pointing downward. So again, I wasn't quite confident there. I wanted to make sure I'm completely under. And so I turn, and you can see as I pull the chopper towards the middle, the lens is engaged. You can see I was able to grab the lens. And as I pull the chopper to the center, it meets the phaco tip and it crushes that second quadrant. Again, I'm using the phaco tip to grab the lens piece, and then I'm crushing it with mechanical fracturing forces, crushing the lens between the chopper and the phaco tip. I'm using, again, vacuum to bring the piece towards the tip, and then I'm using the chopper to crush the lens and then emulsifying it once the lens pieces are small enough. This is the other component of the second quadrant. I'm going to gently, again, the chopper is flat and parallel to the anterior capsule surface. I pulled the lens piece centrally. I want to really make sure that I'm underneath the lens material. It's not quite separated from the bulk of the cataract. And so I'm just trying to be real careful. I pulled that lens piece centrally, and then I fractured that piece and cut it in half. You can see there are still some fibers, adhesions between the fragment and the rest of the cataract. And I used the chopper and the phaco tip to crush the adhesion right about there. I decided not to eat that epinuclear material there because I want to keep it there for protection. I rotate the second heminucleus in front of me. I make sure the chopper is definitely under the anterior capsular rhexis edge because I slid it across. I pull the chopper centrally. I have the phaco tip fairly deep in the bag, and then I'm able to fracture the third and fourth quadrants. And I made sure I separated the lens pieces completely and separating any potential leathery components of the lens material from one another. I go ahead and fracture and bisect the third quadrant, again using mechanical fracturing, placing the chopper out to the equator, and then crushing the lens piece completely. Again, I'm tackling the lens pieces, again using successive movements of mechanical fracturing forces, placing the chopper out to the equator, and then crushing the lens piece, bisecting the lens piece. I tend to place the phaco tip deeper in the bag so I can get a very nice chop, a deep chop into the densest portion of the lens material. This helps minimize any leathery attachments of the cataract, and it helps reduce the chances of a posterior plate. So I'm going to tackle this second component of this third quadrant. I want to make sure that I maneuver this lens material so that I can get a maximal crushing force around the girth of the lens. You can see I was manipulating that lens material, and I'm trying to find the best approach to crush the lens maximally and at the girth of the lens. So I'm placing the chopper and the phaco tip around the girth of the lens. I'm crushing it completely in half, and then I'm able to go after each piece successively, again using mechanical fracturing forces to crush the smaller pieces, and then using high vacuum and bursts of intermittent phaco energy to remove the lens pieces. This is that other component of that piece. You can see how dense this lens is. I'm grabbing it with the phaco, and then I'm crushing the lens piece between the chopper and the phaco tip, and then when the pieces are smaller, I'm emulsifying the lens pieces. I'm much more focused on crushing the lens pieces, and I'm less focused on pedal to the metal phaco. I don't like to just emulsify with high intensity ultrasonic energy. I like to crush the lens pieces first, using mechanical fracturing forces to really crush the lens pieces. And then once the pieces are small enough, I'm okay with emulsifying it. And why do I do it this way? Because I found that I have much clearer corneas doing it this way. And I feel like I have a much more control of the eye when I do it this way. So at this point, I decided to put some more dispersive viscoelastic. I take the chopper out of the eye, and then I inject the eye and fill the anterior chamber and coating the corneal endothelium with more dispersive viscoelastic. Once the eye is filled with viscoelastic, I'm able to easily manipulate this final quadrant so that the piece is right between the chopper and the phaco tip, and I'm crushing the lens piece between the chopper and the phaco tip, and I'm able to just go after it one by one by one. Again, because the eye is filled with the viscoelastic, I'm able to just manipulate the lens piece mechanically with the chopper and the phaco tip, and then crushing the lens piece maximally by dividing the lens pieces into smaller pieces and smaller pieces. And then when I feel ready to do so, I go ahead and try to emulsify the lens pieces. You can see I like to kind of tease the lens piece into the proper orientation and position. I can maximally crush the lens piece between the chopper and the phaco tip. You can see that the anterior chamber is still filled with viscoelastic during all that maneuvering of crushing the lens piece. And now that the lens pieces are small enough, I'm able to emulsify these smaller pieces fairly easily with minimal ultrasonic energy. And so you can see a lot of the maneuvering is really primarily with the chopper. You can see I pronate and supinate my hand. I try to manipulate the lens pieces so that the chopper and the phaco tip crush the lens pieces maximally. I use some vacuum to hold and grab the lens pieces as needed. So that was the last quadrant. There's no more endonucleus left. And I'm going to go ahead and remove the epinuclear material. You can see I'm very slowly removing, and this is not just regular epinuclear material. This is very stiff and dense epinuclear material that requires a little bit of time, a little bit of burst of ultrasonic energy with the high vacuum to remove the epinucleus. So again, you saw me pull the phaco sleeve way back, and this helped expose the metal component of the phaco tip. This allows this phaco tip to act more like a chopper than an actual ultrasonic tip. And so I'm able to leverage, using mechanical fracturing forces, the phaco tip as a chopper, crushing the lens piece between the chopper and the phaco tip. I'm able to do this because I'm able to get around the girth of the lens. And this allows me to crush the lens and avoid a posterior plate. This also helps me maximally crush the lens and minimize getting the leathery attachments. And I was able to successively crush the lens pieces into smaller bite-sized pieces. I had excellent chamber stability. I was able to do all the phaco and manipulation at the iris plane. I was able to minimize ultrasonic energy and also have a very controlled environment as I mechanically crush the lens pieces. And by doing this, I feel like this is a much more safe and controlled environment. And despite the density of these lenses, I tend to have much clearer corneas. So I hope this was helpful to you. Please like and subscribe, and I thank you for your attention.